How do different epilepsy seizure types affect thinking? How do different types of epilepsy seizures impact thinking and cognitive abilities? The answer varies based on the type of seizure and the brain regions involved. Let's explore how this works. Temporal lobe epilepsy is the most common form of focal epilepsy. It primarily affects the temporal lobe, which plays a crucial role in speech, learning, memory, and emotional behavior. Seizures in this area often lead to memory issues, particularly episodic memory, which is the ability to recall specific events. Damage to the hippocampus, a key structure for memory, is common in these cases. People with temporal lobe epilepsy may also experience anxiety and depression. More frequent or prolonged seizures can worsen cognitive deficits, especially in memory. Next, we have frontal lobe epilepsy. This type affects the frontal lobe, which is responsible for higher cognitive functions like planning, organization, and emotional regulation. Seizures originating here can impair attention and executive functioning. Individuals may struggle with planning, task performance, and controlling their emotions. Generalized epilepsy involves both hemispheres of the brain and can lead to widespread cognitive slowing, attention deficits, and memory problems. Cognitive impairment in generalized epilepsy can affect various areas, including language and visuospatial skills. The frequency and duration of seizures are linked to the severity of cognitive decline, with more frequent seizures increasing the risk of progressive mental deterioration. Absence epilepsy is characterized by brief lapses in awareness. These seizures mainly affect attention, causing transient attention deficits during and sometimes between seizures. Benign epilepsy with centrotemporal spikes is a childhood epilepsy syndrome associated with language difficulties and mild cognitive impairments. Cognitive deficits here are often linked to abnormal brain activities that disrupt language processing. Juvenile myoclonic epilepsy is another type that can lead to impairments in executive functions, such as working memory and cognitive flexibility. Several factors can influence cognitive effects. Interictal epileptiform discharges are abnormal brain activities between seizures that can disrupt cognitive processes like memory retrieval and attention. Higher frequency and longer seizures are associated with more severe cognitive impairments. Additionally, anti-seizure medications and the social consequences of epilepsy, such as stigma and stress, can also impact cognition. Some cognitive impairments, especially those occurring during or immediately after seizures, may be reversible. However, chronic uncontrolled seizures can lead to lasting cognitive decline. In summary, the impact of epilepsy seizures on thinking is complex and varies by seizure type, brain region involved, and other factors. Temporal lobe seizures mainly impair memory, frontal lobe seizures affect executive functions, and generalized seizures cause widespread cognitive slowing. Understanding these differences is essential for tailored cognitive assessment and management for those living with epilepsy. Always consult healthcare professionals for personalized advice and support.